Well, thousands of runners will be taking part in the big race tomorrow. Many people will unfortunately be sidelined by hip and knee pain. So today we have Dr. Christopher Sherry with us, an orthopedic surgeon with some solutions for dealing with aches and pains that may unfortunately sideline some running careers. And you're sort of one of them. You were an avid runner and you kind of took yourself out of the mix. Yeah,
unfortunately, you know, with avid running, people that run long distances, it can have effects on your knees and hips, and unfortunately some people can't do it their whole lives.
Yeah, unfortunately, and that's got to be difficult because so many people who run just get this passion and love the experience being out, and for some folks that ends up being not something that they can continue doing.
Unfortunately not, and you know, the runners, they love to run, and it's sometimes difficult to modify the activity.
Is there something that specifically causes hip and knee pain?
Well, when we're talking about hip and knee pain, you know, specifically arthritis in the knees and hips, there's a lot of different factors that are involved with that. Some of it's genetic. Some people are kind of predisposed to developing these sort of problems as they get older. A lot of it's environmental as well. Weight is the biggest thing that I talk to my patients about. People that are heavier are shown to have increased rates of hip and knee arthritis as they age. There's also other environmental factors, injuries that occur throughout the course of your life, and people are just generally they're tougher on their joints, they have more wear and tear, can develop problems as they age.
So can starting out running when you're a child or maybe a teenager or young adult, can that put you at more of an increased risk of developing some issues later on, or is it something that person by person, we're all just made so differently?
It's definitely a person by person type situation. If you don't have any issues and not have any problems, then I encourage you to be active and do the activities that you like to do.
Is it sort of one of those issues you have to kind of listen to what your body's telling you?
Absolutely, absolutely. When you start having these aches and pains and there seems to be a problem going on, that's definitely something you want to take a look at and maybe seek help.
Are aches and pains sort of that first symptom that we need to pay attention to, and are there other things that we should be aware of and look out for? Will you get swelling and those sorts of things?
Sure, you know, obviously pain is the #1 complaint that I see with patients. They start having pains in their joints with range of motion or with activity, sometimes exercising, sometimes normal day-to-day activity. As symptoms progress, you can absolutely get swelling in the joints, which is caused by the inflammatory reaction from arthritis that we see. As symptoms progress and get worse, we can start seeing stiffness in the joints, lack of range of motion, not being able to get the full range of motion in the knees or hips. As symptoms get very severe, we can always also see deformity in the joints. A common one in the knees, we can see that bow-legged deformity or knee knock deformity when we're getting very severe arthritic symptoms.
Okay, so are there treatments that can be done along the way? I mean, you don't jump into surgery as your very first option.
Absolutely not. Absolutely not. You know, there's a lot of different conservative treatment options that I talk with patients. The biggest one, the most modifiable one I talk to patients about is the weight. You know, getting to your ideal body weight is going to allow you to reduce that risk of developing osteoarthritis as you age. There's also exercise activities, strengthening the muscles around the joints.
Physical therapy, maybe?
Absolutely. There's physical therapy, home exercise program to support the joints and reduce that risk of osteoarthritis. There's different medications that we use, specifically anti-inflammatory medications, reduce the inflammatory response that arthritis causes. More advanced type treatments, we do injections into the knees. There's cortisone injections that we do. There's also lubricating gel shots that we inject into the knee, again, to reduce that inflammatory response.
And then eventually, if they're looking at surgery, I think people may be surprised at just how advanced those surgical procedures are.
Sure. You know, if you fail the conservative side of things, there are surgical options that we have. There's arthroscopic knee surgeries, and hip surgeries, which are less invasive, easier to recover type surgeries. As your symptoms get more advanced, arthritis becomes more advanced, we talk about replacement type surgeries.
And you love to share information with people who are interested. In fact, you have a community seminar coming up.
Absolutely. I'm really excited about this. It's an opportunity for me to get into the community and discuss my specialty, which is knee and hip arthritis, and discuss different options, solutions, and answer questions that patients have.
Yeah, and pre-registration is required, but it's free to attend.
Absolutely.
And so anybody who may be even thinking about some kind of a treatment option.
Absolutely. It's just it's a good seminar that we do and that Spectrum puts on, and free to the community, and just to, again, get some good information and answer some questions.
And if people are interested in getting in touch with you, you're easy to find. You're part of the orthopedic and sports medicine group.
Correct.
At Spectrum Health.
Spectrum.
Thank you so much.
Thank you.
All right, stay right there. More of 8 West when we come back.
Are you West?